Here is your one-stop guide to FFP from me, Asia, a fourth-year medical student at the University of Nottingham. I always get loads of questions from younger year students about how clinical placements work, how clinical years work, what you're supposed to do, all of the questions I had myself. So this video is kind of just a short overview of what FFP or Foundations for Practice is, what to expect and how to make the most out of it. This is probably more relevant for students at the University of Nottingham. However, you're more than welcome to stay if you go to a different university. Maybe you'll find something that's interesting for you, who knows. So Foundations for Practice is your first big block of placement when you're at university after you've done your BMed Sci degree. FFP or Foundations for Practice starts in late February, early March time of your third year at uni. And it's preceded by a little kind of preparations for practice couple of weeks where you go into GP practice, you have some seminars, and you do some reflections about your time in practice and your time speaking to patients, just to try and get you back into the rhythm and the swing of being on placement. However, I do feel like those 2 weeks are quite different to what it's like once you're actually on placement. I still think it's a good kind of foot in the door for getting you ready after you've taken quite a long time away from clinical medicine while you've been doing your BMed Sci. FFP is formed of 5 different placement blocks, all of 6 weeks, which are specialty skills, which is 6 weeks in total, with 2 weeks in dermatology, 2 weeks in ophthalmology, and 2 weeks in ear, nose, and throat, or ENT. Then surgery, medicine, psychiatry, and GP, general practice. Each of those placements are 6 weeks. FFP is also broken up by 2 weeks of Easter holiday, 2 weeks of summer holiday, and then there is also a few weeks study leave before your exams in November. I'm going to talk about the placements in the order that I went through them and just some of my top tips for each of the rotations. This isn't an exhaustive list, and as always, if you do have any questions, you're more than welcome to reach out to me by leaving a comment or getting in touch with me on social media. I started with specialty skills and I started on dermatology, which is quite a nice one to start on because I had quite a good understanding of a lot of the dermatology already. Just as someone who's struggled with eczema and things and other skin conditions, I had a good understanding of it, at least better than some of my other placements before I went into it. And I did really, really enjoy my dermatology placement. It helped that I had a really good teaching fellow who went through all of our teaching with us too. So dermatology consists of different clinics that you'll do where you sit in with a dermatologist who sees patients, and this might be for follow-up, to initiate treatment, to see how they're getting on. You'll also have some teaching sessions mixed into that where you might have some patient actors coming in and you having to do role plays with them. And then you should also do some skills like suturing and taking a swab. It is only 2 weeks long, so it can feel like a lot of information is jam-packed into those 2 weeks. So I would recommend, if you can, for any placement that you're on, trying to get ahead of the content a little bit earlier so you don't feel as snowed under when you're starting. Alongside each of your placement, you'll be expected to get a certain number of workplace-based assessments, usually 5 per attachment, covering different skills relevant to that attachment. So the ones that you had to get for dermatology were describing a rash and describing a lesion, and you need to get these signed off. You'll also need to do a CBD or a case-based discussion per attachment where you bring a case that you might have seen whilst you've been on placement and you and your teaching group discuss it. Your teaching groups will be fairly small, usually no more than kind of about 15 of you. So it means that you do get to know your teaching groups quite well. And they might change a bit from placement to placement, but you might feel that they are kind of broadly the same and you'll be with a lot of people that you've been with previously. Next, you'll be on ENT or ophthalmology. It just depends on which way around your rotations were. On ENT, it's kind of the same as it is for ophthalmology. You'll have a mixture of clinics, teaching sessions, and then for ENT and ophthalmology, you might have the opportunity to attend theatres as well. So an example of one of the theatres that I went to while I was doing ophthalmology included a cataract removal, which was interesting. And then for ENT, you can see people having their tonsils or their adenoids removed, lots of different ENT-related surgeries. In ENT, you also got to sit in an emergency clinic, which is where you see things that are a little bit more acute. We did also go on ward round for ENT, But ENT's ward rounds are quite different to ward rounds that you'll see in surgery or medicine, because there's usually a far fewer number of patients. But that is specialty skills in a nutshell. You will need to get DOPS throughout your time on FFP and AP. So I would really highly recommend to get as many of your DOPS signed off during FFP that you can, especially for ENT and ophthalmology. Try to get your otoscopy and fundoscopy signed off. Otoscopy, you probably will see that again in GP, but I haven't had the chance to do fundoscopy since I did my ophthalmology placement. I didn't really see it in GP, so it's important that you get those things signed off then. Next is surgery. Surgery is renowned for being one of the busier placements, and it's just because it might have a working style that you're not necessarily used to. So it's kind of just a brief checkup on the patient, see how they're getting on, see if they're doing okay, and then moving on to the next patient. It can be helpful if you get to ward round a little bit earlier to find the F1, speak to them about any patients. You can also help prep notes for the ward round, which is where you write a bit about why the patient's in hospital, what's been going on with them, if anything's changed from the day before, that sort of thing. In surgery, you cover 6 different weeks, and you'll be on different wards based on those weeks and have teaching based on those weeks. The 4 topics of each week include colorectal, upper GI, breast, urology, orthopedics, and vascular. And you'll have different learning objectives and conditions that you'll need to cover in association with each of those weeks. I would really recommend at this point downloading the MLA content map so you can match the conditions that you're doing on placement to the MLA content map and see if there's anywhere where you might need to plug your knowledge, because sometimes you don't cover all of them on placement. You will need to do wider reading, so the resources available to you on Moodle are not the only resources that you should be using and might not cover all of the learning outcomes. So you'll have to find other ways of getting that information. I really like using PassMed and their textbook, but you can also use resources like Zero to Finals, the NHS website, other treatment guidelines, things like that. So like I said, surgery can seem a bit full on. However, if you do have an interest in surgery theatres, that's a great place for you to get some experience and get hands-on, because surgeons will allow you to scrub in. It is one of your DOPS to scrub in, so make sure that you do that whilst you're on your surgery placement. And that allows you to get a bit closer to what's happening and to see things in a bit of a different way. Other DOPS that you'll probably be able to get while you're on your surgery rotation include bloods, especially on the surgical assessment units. Lots of patients will be having bloods regularly. You might also be able to get some cannulas signed off, catheters if you're doing urology clinics. Once again, you'll need to also be making sure that you're doing your workplace-based assessment. At the end of each of your 6-week placements, you'll need to complete a reflection. The reflection is 750 words, just talking about what you've done during your 6 weeks, what you've learned, and what you hope to take with you into your next rotations and your practice in the future. And you'll have to have 2 meetings, a mid-attachment and an end-of-attachment meeting with your consultant supervisor, who the medical school or the placement team should allocate you. If you're having any problems finding your consultant supervisor or tracking them down, just get in touch with the placements team and they should be able to help you. It's up to you to organise these meetings. They're not organised for you. And I would say it's best to get in touch with your supervisor at the start of your placement, because their calendars will fill up very quickly and they might not have time to squeeze you in during the last week to get your sign off. And that goes for every placement, not just surgery. Specialty skills does work a little bit different, because you'll have a different supervisor for each of your 2 weeks who will do mini sign-offs as you go. After surgery, I was on my GP placement. So for GP placement, depending on if you have a car or not, you can be sent further afield than your kind of base, which was QMC for me, because I was in the Nottinghamshire hub for FFP. I really enjoyed my GP placement. If you know anything about me, you know that I love GP and I want to be a GP. So this was a great placement for me. I was at a really lovely practice and everyone was fantastic. All the patients were really nice, really happy to see medical students and have a chat with us. Your GP placement is quite different to your other placements, because you'll have Mondays off for self-directed study, and then you'll have group teaching sessions on Tuesdays with patient actors talking about different conditions and practicing taking histories. And then from Wednesday to Friday, you'll be in your GP practice. Some GPs might do it a little bit differently, where you might be in Wednesday, Thursday, and Monday, but you'll still have that 1 day off a week for self-study. Now, there aren't any specific learning objectives for your GP placement because you could see anything, but it's important to brush up on things that will commonly come up in GP. So that includes things like earache, ear problems, stomach issues, coughs, colds, even women's health, things to do with the menopause, blood pressure checkups, diabetes checkups. Those sorts of things are really common in GP, so they're good conditions to brush up on. And there are some resources on Moodle which go over the common things you should expect to see in GP. Depending on your practice will depend on your experience and what you'll get to do during your GP placement. But for me, we had our own patient list that we would see. So we'd be in a room to ourselves, we would see each patient, take a history from them, write up our findings on the patient's notes, and then after that, the GP would come and review the patient with us, retake the history, and we would come up with a management plan together, and we could share what we had thought was going on with the patient. So don't worry, you'll be completely supervised. You're not going to be seeing patients and giving them medications or giving them diagnoses by yourself. It's just a chance for you to get more comfortable with speaking to patients and formulating management plans whilst having the support of your GP there with you to help you at every step of the way. I really love this because we had a lot longer to speak to the patients than a GP usually has in a 10-minute appointment. So it meant that sometimes patients really just needed to get stuff off their chest and have a chat with us. And it was nice because we could give them the time to be able to do that. Also, if you're interested in completing an audit, GP is a great place to do that because you'll have the time to do it, and usually practices will have audits that they need doing. So I did one about cervical smear uptake at my GP. The EPAD for GP does work a bit differently. It can be really confusing at first. I'm not going to go through every part of the EPAD, but each part is self-explanatory, really. You just need to sit down and have a look through them and think when you can get those different things signed off. But if you want a video of me going through each of them individually, I'm happy to do that. Or if you want to ask me any questions, you always can. Next, I had my medicine placement. Once again, quite a busy placement like surgery is. Depending on the ward rounds will start between 8 and 9. Once again, massively depends on the ward. A lot of the medicine wards that I've been on, ward round starts around 9ish. Some of them like to start a little bit earlier, so it just depends. It's worth asking the team when you get there when ward round usually starts, because it's horrible walking in late to like the team huddle. The weeks that you'll cover include chest pain and palpitations, cough, shortness of breath, unwell diabetic and disorders of the thyroid, GI upset and GI related conditions, and headaches, seizures and weakness, so neurology. Once again, I'd recommend having a look at the intended learning objectives and conditions you're supposed to know, and then base your learning off of that. You will do medicine and surgery again during AP1, so any conditions that you don't think you've covered in FFP will be covered in AP1 later, don't worry. Don't go learning the whole MLA content map in FFP. And then finally, you'll have your psychiatry placement. This does vary massively depending on where you're placed. So there's different types of psychiatric units that you can be placed at. So that includes child and adolescent mental health services, or CAMS, low secure, medium secure units as well, general adults inpatient units too. But you'll get to see a whole variety of different patients and presentations and talk to them during your psychiatry placement, as well as having weekly teaching sessions, usually on a Thursday and Friday, with clinical educators and patient actors. Things you'll cover during your psychiatry placement include personality disorders, depression, anxiety, mood disorders, psychosis, postpartum mental health problems, as well as children and adolescent mental health problems too. So it's a really varied placement and you'll get to see a lot of different things. It's really great to practice taking your histories during this placement as well, because you'll usually have a lot longer to sit with the patient and talk to them. And then briefly just talking about the end of FFP in November when you'll do your exams. Your exams will consist of 2 knowledge papers, both marked out of 100, and 2 OSCEs, which are made up of 3 paired stations and then 8 single stations. So the paired stations mean that you'll usually stay with one patient through 2 stations and they'll be linked together in some way. And these will be around mid-November time. So you'll usually have your knowledge papers on each Monday of the 2 weeks of exam prep, and then your OSCE throughout the week in each week. The pass mark for clinical years rises to 50% from 40% in preclinical years. and there is a resit period in January for FFP exams too. So I hope this video has been helpful and given you a bit of an overview of what to expect in FFP and your first year of clinical placements. I do know it's a lot of information. You can definitely come back to this as you go through each rotation, but I hope it's helped you and given you a little bit of an understanding of what to be doing, what DOPs to get signed off, that sort of thing. You'll probably see fourth years and fifth years on placement too. So if you need any help or support, you can always ask one of us. We're more than happy to help. And if you do have any questions about placement, please drop me a message on Instagram at Aisia Lea Medic. And if you liked this video and you'd like to see more about what I get up to whilst I'm at medical school and other things that I do, then make sure to subscribe to this channel. I hope this has been useful.